Hello, everybody. It's 12 o'clock, and we're going to give it a minute or two just for more people to join. We have a lot of people registered for this Zoom series that Montefiore Nyack Hospital is doing, and we're just waiting for more guests to arrive. So we're just going to give it another minute. Okay, so here we are. And first of all, I want to thank Dr. Chak and Sue Stone for being here with us today. I know that you've been very busy, especially during the last year almost, going into a year. And so that everybody knows, Dr. Chak was just seeing patients and he just got here 2 minutes ago. So that just shows how busy people are here at Montefiore Nyack Hospital. So a big welcome, and let me introduce our speakers for the day. So we have Dr. Chak, and he's the Chief of Infectious Diseases here at Nyack Hospital. And then we have a registered nurse, Sue Stone, who is also a master's in public health, and she's certified in infection prevention and control. And she's also the director of infection prevention and control here at Nyack Hospital. So of course, you're already gonna know that they're very savvy on everything that is infection prevention, flu, COVID. So that's the reason why we're having this webinar. And just to give a little bit of background, I just learned there are about 61,000 deaths because of flu every single year, as per the Centers for Disease Control. But it's not just about the people who are falling dead. Of course, that's horrible. It's 61,000 families that are being affected, as of 2018 by this disease. But also it's like 45 million people getting sick every year with flu. So, and now that we have the COVID, it's adding to this incredible amount of people that are getting sick. So I think it's very important to start asking, what is flu? Like, we all hear about the flu, but I feel that often flu gets confused with a cold or pneumonia or any other respiratory disease. So what is flu in reality? Dr. Chak?
Sure. Thank you very much, Sandra. It's an honor to be here, and thank you for the opportunity. And thank you. This is a very crucial time of the year when we will be seeing more and more flu cases. So just to jump right on to the first question that you asked, the basic difference between flu and the so-called common cold is for the most part, what happens is the flu can invade the rest of the body. The common cold is typically limited to the upper respiratory tract system. So you'll have a runny nose, and you can have a low-grade fever associated with it. However, if you have the flu, typically you'll have systemic symptoms. What I mean by that is sometimes it can invade the lungs, it can invade the rest of the body. So if you have body aches, fever, and a cough, many times it should be considered as the flu and not just as a common cold. So that's one of the main ways that we would distinguish between the common cold and the flu. typically the season of the flu starts more in the fall and winter months, and it can last up to the spring months also. So there's a span of about 5 or 6 months where we see flu. Not to say that we can't see it in other months, but it's predominantly in those months that we would see it.
Mhm. And so that's very clear. I'm feeling like, the cold is pretty much in your head, while the flu, can get a little deeper into your body. So now what will be the difference between the flu and COVID?
So for the longest time, we had difficulty. The difference between the symptoms is very subtle. So many times with COVID, you will not have a runny nose. You can have all the other symptoms. In addition, that we're finding out certain other symptoms, such as people report taste changes or loss of taste rather, loss of smell sensation can go away. But otherwise, you can have body aches, you can have a cough, you can have other flu symptoms with COVID as well, just as you can with the flu.
This all gets very complicated because you're talking about some of these symptoms, and then I'm thinking allergies. Like it could be also confused with some allergies, right? Like seasonal allergies.
That's correct. Yes, exactly. That's why I think it's very crucial whenever you have these symptoms, you reach out to your physician, your primary care, or you can reach out to one of us, and we can certainly evaluate that further. So that's why it becomes crucial. Sometimes the differences are very subtle. So to figure that out, I think it's crucial that you contact your medical care professional.
Right. Now let's be realistic. Not a lot of people like to go to the doctor, and especially if they think they have a cold, they like to treat it at home. Chicken soup, that's it. So when do we really need to seek medical care? What do I need to feel to say, okay, no more chicken soup, I need a doctor?
Right. So, so many times I tell my patients, your body will tell you. Your body, you've lived with your body for an X amount of years, however old you are. When things don't feel right, just have a low threshold, especially these days when we are still seeing a rise of COVID. We can certainly discuss that. I think we are on the so-called second wave of COVID. So that's why I think it becomes more crucial to reach out to your medical care professional to find out. But what you mentioned about chicken soup, yes, that's one of the old remedies, and I think it works fairly well. And we can go over the reason why it works pretty well.
Yeah, I'm a dietitian. I can't hide that. Like I try to solve everything with foods.
That's right.
Now, Sue, thank you. Now, so tell us a little bit about how contagious they are, COVID versus flu. Is one more contagious than the other? Is it the same?
It's a little bit different. I would love Dr. Chak to we're learning. This virus is fairly new, right? One day we say you need to wear a surgical mask. The next day, if someone has, for example, in the hospital and they're using a nebulizer, that might aerate it a little bit more and you need a higher filtration mask. But we're learning a lot about COVID. It is a new disease, COVID-19, but we have a little track record with flu, influenza, a long track record with influenza. So we know what works. And at the hospital, we tell people to protect any mucosal membrane, which is your eyes and your nose and mouth. And I think in the past, we didn't appreciate the portal of entry as being your eyes. Now we're seeing it as a way to prevent any kind of viral introduction. So we are recommending everyone to protect their eyes and nose and mouth when they're caring for a patient, regardless of what their diagnosis is. So I'm going to pass it on to Dr. Chak.
Sure, thank you. So I just have to start off with saying Sue has been just such a tremendous inspiration. He's been such a tremendous help throughout the crisis. Her leadership was just incredible. We're very fortunate that she was part of our team. So coming back to your question, the contagiousness, as Sue mentioned, we're finding more and more about the COVID virus. Our views were very different back in March, as you probably recall. Even Dr. Fauci, the head of the CDC, the NIH, he had recommended initially not to put any face masks on. They did not think there was any benefit. And naturally, us at Montefiore Nyack and other institutions went along with that with that recommendation. But we're finding out more and more, it is certainly much more contagious than the regular flu is. We do suspect that it might be living on the surfaces for an extended period of time. It is airborne, so the 6 feet that is being emphasized on, within 6 feet, it can travel, and the next person can certainly acquire it. So as time progresses, we're finding more and more about it, but we certainly feel that it's much more contagious than the regular flu is.
And do you think we can predict that this year we're going to get more people with flu because of COVID, like because of everything that is going on?
So you want to take that, or should I take that?
So I think we have an obligation to one another to wear a mask and do great hand hygiene. And I think like the Southern Hemisphere that saw a decrease in flu, we have the potential to do the same in our environment and in our country. And mask use when we're in a public setting is vital to preventing the flu. And I'm an optimistic, and I believe that we can lower our flu rates for this year if we follow these very simple guidelines, such as a flu mask and wearing it in a proper way, putting it on with your ears and not touching the front where you could contaminate your eyes, nose, and mouth with my hand as I'm taking it off, and doing a very good hand hygiene. We can also lower our flu rate by vaccinating, getting vaccinated for influenza. So I think I'm optimistic in hoping that we will see a dramatic decrease in influenza cases in our community.
If I may just add one more thing, again, Sue is absolutely right. Just to emphasize on the fact, typically the flu season occurs a little bit before our season in, as Sue mentioned, the Southern Hemisphere, such as Australia and New Zealand. They see the flu before we do. So fortunately, their cases were extremely low this year, and that's always a predictor. However, the point that we need to emphasize on, as Sue mentioned, was they were a little bit more aggressive with their recommendations, i.e. the mask wearing and social distancing and hand washing. So that's how they had controlled their COVID cases, and they had a very limited number of flu cases. So if we do the same, again, we would have an obligation as individuals and as community and as a nation to control this, and we can all do our part, and hopefully we can control the flu as well as the COVID crisis in a much better way.
Now, what I love the most about this community Zoom series is that attendees can put their questions in the Q&A or the chat box, and we're starting to get some of those questions. So here is one. Do you know why chicken soup works?
You want to take this, Sandra? Go ahead, this is yours.
You know what's gonna fire back to me. Yes, so the reason why it works is because it's loaded with protein and vitamins and antioxidants, and especially if you add some vegetables to it, it has a lot of the nutrients that you need to make your immune system stronger. And that's the reason why, especially if you cook it with the bones, you can also get some anti-inflammatory properties in there that, if you have the cold or if you have the flu, everything is inflammation. So the soup is really going to help with that. And especially if you're taking it very hot as you can, you know, the fumes from the soup, or like, you know, the vapor, it's gonna, you know, be almost like a nebulizer. So it has like chemical and physical effects. And thank you for that question. That was really sweet. And here, I think this question might be for you, Sue, because they want to know, they say masks are always falling down off your nose, like all the time. So you have to keep putting them up, and that way you're touching the mask all the time. You just said don't touch it. So how can we prevent masks from falling?
With the paper ones, it's pretty intuitive. You do hand sanitizing, and then you can raise it up and touch it. But I also know there's plenty of homemade ones, and they might not be the right size for your face, or there might not be a metal ring to it. So it really, it's about finding the right fit for you. Some people have longer faces and shorter, but yes, if you have to touch the mask, I would hand sanitize first or wash my hands and then pull it up. But as a general rule of thumb, try to put on your mask and take it off with the ear loops.
Mm-hmm.
I need a new mask.
Now that you're talking about that, you know, like, thank you for saying that you have to find the right fit. Like, for example, my mother, she has a smaller face, and these masks were falling all the time. And I just found out that the kid size are the perfect fit for her, and they're cheaper. So we're happy that we found something that helps. Okay, going on with the questions that we have. Do you think, you know, we're having all these protective measures, like washing hands, wearing the mask, protecting our eyes, not, you know, not being close to people, keeping 6 feet apart, not going into crowds. It's a lot that we're responsible citizens are doing. Do we still need to have flu shot? Come on, with all the measures that we're taking, you know?
So I can't emphasize enough on the importance of the flu vaccine and other vaccines as well. And I would just simply preface by saying that the vaccines in the last couple of 100 years have been very revolutionary, right? They've decreased mortality of all disease processes, be it measles, be it, you know, the list can go on and on, you know, the vaccines that we take on a regular basis. Same thing with the flu vaccine. You know, before the advent of the flu vaccine, the mortality rates were higher. They're still very high. I'm not undermining that. As you mentioned, you know, mortality rates we see anywhere from 15,000 to up to 60,000 in some years for the flu. And we're controlling it much better with the flu vaccine. So what I always say to many of my colleagues and many of my patients is, we have been living in a society or in a world where vaccines had existed. For the past few months, we saw a world without a vaccine, and you could see what a havoc it caused. So if there isn't a vaccine existing already, let's take advantage of it, take it. We will protect ourselves, we will protect our families, and we'll protect our community and a nation and the whole world for that matter. You know, right now, the whole emphasis on COVID treatment is a vaccine development. Everybody has been talking about it. But there are diseases, as I said, where the vaccine already exists. So let's take advantage of it, be it the flu vaccine, be it the pneumonia vaccine, and hopefully we can protect ourselves and our families once we take that.
Yes. So it's just another preventive measure that works really well in summary, correct?
That's correct.
Okay, however, you know, there are a lot of people that say, well, if I get the flu vaccine, I'm gonna get sick, so I'd rather don't get it. You know, like, people are scared, and I hear that a lot. You have no idea how many times we go out in the community and they're like, no, don't give it to me, that makes me sick.
Would you mind emphasizing on that? Is there a specific sickness that they mention, or is it just
No,
a...
they get the flu if they get the vaccine. You know,
Right.
like they start feeling sick, they get some symptoms for a few days, like cold-like.
Right. So myself included, whenever I take the flu vaccine, I feel like I have the mild flu for just about 2 or 3 days. So typically what happens is you get a localized reaction where you do get mild body aches and occasionally a sniffle here and there. But I've never seen patients getting so critically ill after taking the flu vaccine. However, I do see the other side of it, where people have not taken the flu vaccine, and many of those patients do end up being admitted to the hospital. Many of those patients, God forbid, end up admitting to the ICU setup. They're on a breathing tube. They develop what we call ARDS, Adult Respiratory Distress Syndrome, where the whole lungs are compromised. So the other side of it is significantly much worse. With the flu vaccine, yes, maybe for a couple of days you can get some symptoms, but they're nothing like what people can experience when they get the actual flu. Um, in addition, just to let you know, the flu vaccine does have eggs component in it. So if the patients are truly allergic to eggs, they should avoid it. There are certain alternatives. And again, you can speak to your medical care provider and they can tell you what the alternatives are.
Is latex another contraindication for the flu shot? Like a latex allergy?
Maybe a mild, but no, I don't think it's an absolute contraindication.
And the vaccines will say latex free
Right.
on certain
Okay.
vaccines. I think.
Okay.
It depends on
Yeah.
The multi-dose, I think
Mhm.
might have.
Right.
I
So,
also want to mention that the flu vaccine virus is a dead virus, and it takes about 2 weeks for your body to build up antibodies for protection against the flu.
So does that mean that if I get the flu and I get sick 2 days later, that's not related to the vaccine, but something else? Because it takes 2 weeks for the vaccine to really start to work?
So the question is, if you get some symptoms immediately after the flu vaccine, right, then yes, it can take 2 weeks. So right, if you get some symptoms immediately, then certainly reach out to your medical care professional for sure.
Yeah, and it's not the vaccine. We can't blame the vaccine for that. So we still should get.
Right. Right,
Okay.
exactly.
Now there is someone here sending a question and it says, if you're taking very good care of yourself, wearing your PPE, doing everything that you can, washing your hands, what will be the chances that you still get flu if you don't get the flu shot? Like, do you have any statistics on, how many people who don't get the flu shot get the flu versus those that get the vaccine?
Go ahead, Sue.
Yeah, I think we don't know how well we do things. For example, we touch our face approximately 23 times every hour. How can you be assured that you did good hand hygiene every time you touched your face? So although we're all very cautious, like Dr. Chak said, let's try to be one step ahead and use every way of preventing virus influenza as we can. Known tactics, which is the vaccine, and obviously frequent hand hygiene and mask use.
Mm-hmm.
Right, and just to, I'm sorry, just to emphasize on the same point, we had seen many physicians, nurses, who were very cautious with the PPE protocol, wearing it, taking it off. And despite that, some of them had still contracted COVID. We know some cases where they were extremely vigilant about, wearing a proper mask and whatnot. Nevertheless, they still came down with the COVID virus.
Mm-hmm. Yeah. Something that I've noticed just in my personal life is that people can get sick with the flu. Like the vaccine is not gonna stop the flu from entering your body, but it's definitely gonna stop you from a big reaction. Meaning, if you get the flu, but you got the flu vaccine, you're not gonna react or get as sick as when you get the vaccine. Is that correct?
Absolutely, 100%. Yes, we
Okay.
again, these vaccines are not 100% protective. You know, we can look, for instance, many of my patients will come to me and they always tell me that, look, I got the pneumonia vaccine. Why am I getting the pneumonia? First of all, there are many forms of pneumonia. Number one. Number two, it's not 100% protective, but as you stated, Sandra, the patient's symptoms will be very mild. Not mild, but milder, you know, than if they did not get the vaccine, right?
Mm-hmm. Now, this question I think might be for you, Sue. How do you prevent your glasses from fogging with a mask? That's a very good question.
I'm wearing glasses. I put my glasses a little bit further or getting anti-fog. I don't know of any other magical tricks, but it's a good question and I do struggle with it, but a better seal over your nose also might help with that as well.
You know, I don't know if this works, but this question is just making me think of this. There is an anti-fog spray. You know, you usually use it for like your car windows and stuff. Just now I'm getting this idea that it might work with your glasses. I don't know. So that's a suggestion, something to find out. Now moving to some questions about COVID that we're getting here. If you have the COVID antibody, what is the chance that you still contract the COVID-19?
So if you have antibodies, is that the question? If you have antibodies positive, right? So I think the latest on that is these antibodies may only exist for about 6 months of duration, or maybe even shorter than 6 months. So we just need to be cognizant about that fact that it might be only for 6 months.
And can you still be contagious during that time?
When you have antibodies?
Even if you're yes, if you have the antibodies, if you had COVID, even if you're asymptomatic, can you still be contagious?
Hopefully not, but I think as Sue is mentioning, we should still emphasize on mask wearing and doing all the proper steps. That should not preclude us from doing any of that.
Okay, and what about the flu? Like if you have some short-term localized flu symptoms after the flu vaccine, are you contagious during that time? That's a question I'm getting here.
So immediately after the flu, or is there time duration? Right. So if you have flu-like symptoms, you potentially can be contagious, yes.
Okay.
Right after.
And if you once had if you once had COVID, are you at a higher risk to get COVID again, or you shouldn't?
So we don't know yet. I think there's a couple of cases where it's reported where patient had COVID before, and then they had another, they had a repeat episode of it again, but we don't know for sure yet. Hopefully the antibodies do protect you for a while, but again, as I said, most of the experts are saying it's probably going to last only about 6 months or so.
Yeah, so maybe that's something that we will find out during the second wave.
That's right.
Hopefully it doesn't hit us hard, but
That's right.
Okay, now moving a little bit to children, because I'm getting a question here about children. Is it true that diarrhea is a symptom of COVID-19 with toddlers?
I think it's a symptom even with adults, and with kids we do see some GI symptoms as well. So diarrhea can be one of the symptoms. We haven't seen cases of profuse diarrhea, but nevertheless, people do have some diarrhea associated with COVID.
Okay. And I just have to thank Eddie, I think is her or his name, because I'm getting a comment here. Using shaving cream on your glasses prevents fogging up. How great is that? So now we got the answer from the community. So thank you so much for that answer.
That's great.
Okay. Now let's talk about antibiotics a little bit, because people love antibiotics. Are flu or COVID something that can be cured with antibiotics?
So again, the mechanism of action is flu and COVID is a virus. Antibiotics would only work for a bacteria. So we just need to make that distinction. You know, many times people do come with the flu or common cold and they expect antibiotics to work. Again, the mechanism is totally different. Antibiotics attack the bacteria and they kill the bacteria. They have absolutely no role in killing the viruses. So the simple answer is no, antibiotics will not help for the viral illnesses. That being said, there's certain times when you can have a superimposed bacterial infection with a virus. Again, you would have to contact your medical care provider and they can make that distinction if there's a component of a bacterial infection along with the flu, and then antibiotics will be indicated. In fact, I'm glad that you brought that up. Because there's a higher incidence of antibiotic resistance, and many of those antibiotic resistances do occur when we give antibiotics for a viral illness. And again, there's no role for them. And subsequently, what happens is a couple of years later, we end up getting antibiotic resistance and more of these so-called super bugs, you know, because of that reason. So we need to be cognizant about that as well.
Mm-hmm. Yeah, I think that many people, you know, just go to the doctor hoping for an antibiotic prescription, and when they don't get it, you know, they get a little upset. Right. But it's important that people know that antibiotics are not going to work for everything, right. And especially flu and COVID, it's important to know that it's not the remedy for that. Right. However, you know, going back to the flu vaccine, sounds to me like that there are different types of flu vaccines. Every year is like a new one. Sometimes we are in the community and they're like, do you have the good one or the bad one? Or do you have the one for seniors or not? You know, so how is that? Can you explain a little bit more about like the different types of vaccines or flu vaccines and what the difference is, which one we should be getting?
Sure. So every year there is a mutation that the flu virus goes through, and the scientists make that prediction as to what virus they will be getting this year. So there's, just to simplify it, within the flu virus, there's an H and an N component. So, so what happens is many years they will predict that this year it might be an H1N1 strain or an H3N1 strain or an, you know, so on and so forth. There's, I think there's about 13 possibilities. So based on that prediction, they'll come up with a vaccine that will cover that strain of the virus. Sometimes their predictions are wrong, and that's why every 4, 5, 6 years, you'll see the vaccine not being very effective. So that's in a nutshell. That's how a flu vaccine would typically work.
And I don't know if this is a hard question, but is there a way to predict which one? Like, how do they try to guess which one will be coming? Like, which way it's going to be mutating?
No, that's a great question. So that's what the scientists are doing. I mean, this is what they're doing full time. You know, we're seeing patients full time. That's what they're doing full time. You know what I mean? So yeah. That's what they're working on constantly. You know, they see it based on how the previous years were, and based on that, how it would be predicted in the next coming years.
Wow, that must be a very hard work.
Absolutely.
Yeah. Wow. Okay. Is there a best time to get the flu vaccine? Some people say, oh, October. Other people say September, as soon as the weather changes. So what would be the best time?
The simple answer is as soon as it's available, take it. If it
Oh,
becomes
really?
available end of September, early October, that's typically the time when it becomes available. Take it just as soon as it becomes available. Which reminds me, I mean, now it's been available since the end of last month. And, we have a campaign going on right now where we're encouraging everybody to get their vaccines at this point. So if you're not vaccinated, now is the time, today. Today will be the day that you should get vaccinated.
And I think the flu vaccine is pretty available everywhere, right? Doctors'
Yes.
offices, pharmacies, hospitals.
Absolutely.
So where should we going? Where should we be going for the flu vaccine?
You want to take this, Flu?
You can make an appointment at a pharmacist. The pharmacist is able to do it for you. Obviously, in a hospital setting, we have providers that do it, but even your GP, general GP, will have vaccine available to give you. So make an appointment.
Okay, perfect. Do you have to pay for the flu vaccine, or is it free?
I think it's covered by insurance. There's many areas, and our local Department of Health, Rockland County Department of Health, has flu vaccine. So please look on their website on when they're administering it. You'll probably have to make an appointment. I didn't verify that, but I know they.
I think, and I think as far as I know, it's like for seniors, it's definitely free. So if you're 65, or I'm not sure if it's 55 or 65 and above, it should be free. So it's pretty affordable. So there is no reason why not to take it. Now I'm getting some questions here about flu. Given all the coagulation issues with COVID-19, do you think that taking aspirin prophylactically will be beneficial?
So I've asked that question to some of my colleagues in the hematology department. I don't think there's a direct answer available yet. I think they're still researching about the anticoagulation issue. As it is, we are trying to anticoagulate. We do check, for the patients who are hospitalized, we do check this laboratory data, which D-dimer. So we check the D-dimers. If they're elevated, we certainly give a high dose anticoagulation. I don't know if aspirin has any role at this point. Again, that might change next week. There might be a different opinion next week. So with COVID, as I said, every week there's a different opinion that comes forward. So stay tuned. If there's something, we will certainly inform you guys about that.
Okay. However, there are some things
I just want to give out a shout out to the Rockland County Department of Health. They do offer the flu vaccine to anyone over 6 months on Friday, October 16th from 10 to 2 p.m. And go to their local website for additional information.
Beautiful, thank you. So how long does the flu vaccine last? Meaning, once you get vaccinated.
Sure. So again, different opinions about that, but for the most part, I think it's shown to last about 6 months or so. Sometimes it could be a little bit less, sometimes it could be a little bit more, but usually it's about 6 months, usually.
Mm-hmm. So I have a related question here. It says, since the vaccine doesn't last all flu season, is it best to wait a little later, like November or early December, so it will cover into later in the year, or should you get the vaccine twice?
So as far as twice, some recommendations are people who are elderly maybe should get twice, or they should get a higher dose of the vaccine. But normally for a younger, healthy population, it's usually not recommended. We do anticipate enough of the antibodies that should last you for the whole entire season.
Okay. So don't do it twice, no need for 2 shots.
Unless you're elderly or immunocompromised. You know, if that's the case, then yes, then sometimes they do recommend a higher dose or twice. So again, you can check with your medical care provider on that.
Mm-hmm. Now, there are some vitamins that seem to help prevent the flu. Is vitamin C one of them?
Is vitamin C one of them? So do you want to take that, Sandra?
Okay. So vitamin C, it's supposed to help to make your immune system stronger. There is not a very strong evidence, but it definitely helps. So I wouldn't suggest that you start eating citrus fruits and such as oranges and lemonade with raw lemons to prevent the flu, but it definitely makes you stronger. Now, I've read that vitamin D helps a little bit with the COVID. Like if you have low vitamin D levels, you're more prone to get COVID, or at least if you get the COVID, you're gonna have, a higher infection rate. So maybe just making sure that you follow a balanced diet, full with vitamins and proteins and antioxidants and omega-3 and 6, which are anti-inflammatory. I think that you're going to be much better prepared against flu and COVID than any other disease that you might get. Do you agree with me?
Absolutely, 100%. There's at this point, there's no clear-cut evidence that vitamin C is preventive, or some people have even advocated high-dose vitamin C for sepsis. Again, it's not a convincing evidence as of yet. But that being said, even Dr. Fauci had recommended that the way he keeps his immune system strong, or what he's doing on a regular basis, is taking vitamin C, vitamin D, adequate sleep. We cannot emphasize on that enough. Adequate quality sleep and exercising. So that's what Dr. Fauci had recommended. We're trying to follow those recommendations. So good quality sleep, cannot emphasize enough on that, and a good exercise regimen. They kind of go hand in hand. I mean, I've seen days when I do a good workout, I have a very good night of sleep that day. So if there's a span of a few days where I don't do any workout, my sleep is very disturbed for a couple of days. So yes, they kind of go hand in hand.
Yes. What do you know about the advances in searching for a new COVID vaccine?
So there's a few pharmaceutical companies that are working on it. Few of them are on phase 3, which is very promising. And they should be getting into the phase 4. Once they complete phase 4, then it should be available to the public. I think many of the experts have predicted that they should become available by the end of this year, or early next year. So many of them are predicting they're going through the safety issues and things like that. So yes, it's a work in progress, and it seems like it's very promising that they should become available fairly soon.
Now, I'm a total ignorant on that, and I feel that a lot of people might be feeling the way I do. But what are those different phases? We hear phase 3, phase 4, phase 1, but I'm not even really sure of what that is about. So can you explain that a little further?
Sure. So did you want to take that? Your MPH. You want to take that, or?
Interject. My understanding is phase 1 is we're just trying to figure out the dosage, and then phase 2 we have a wider study where they have a better idea of the proper dosage. Phase 3 is more of a response, a better response of the trial, and it's wider. As you hear, there's multiple vaccines that are being trialed with multiple people to see on the efficacy of it or how well it works. And I make it simple, but Dr. Chak, please give.
No, that's exactly right. I mean, basically, in a nutshell, what they do is a very small sample, laboratory sample will be phase 1. Then they'll probably experiment sometimes on animals or certain other models, that's phase 2. Then they expand the coverage to a small group of humans and then a larger group of humans. And then the final stage is when it becomes available through the whole community. And even then, they're monitoring. So even phase 5, when it becomes more available, the FDA is still monitoring, how it's going. Are people getting any serious side effects? And I'm sure you've seen many of the medicines do get removed from the market, because they're still in that final phase. So just to simplify it, you basically start with a laboratory. You start from the laboratory, then you just keep expanding. So the more it keeps getting expanded, it gets to the next phase. So phase 1, then 2, then 3, then 4, so on and so forth. So, so then they look at the safety issues, and then they compare it also at a later phase.
Now, I think that one of our attendees is actually making a very good point here, and she's asking, how do we feel confident on the vaccines considering that they are being rushed?
So again, I don't think they're being rushed because they're going through the phase. So when they go through the phase, that's exactly what happens. So as Sue mentioned, the first phase is the dose. The second phase is how safe it is. Then the next phase, they check that, would this become a standard of care? So they're not rushing through it, because if they had rushed through it, they would have just come up with a vaccine and said, okay, that's it. Everybody, here's a vaccine, just take it. So that's why it's going through the phases. Otherwise, again, this disease has been there for about 6 or 7 months, and they have been working on the vaccine for 6-7 months. So I don't think it's being rushed, maybe a little bit rushed, but it's not. I mean, they're not making it unsafe if that's what the concern is.
And do you think that if we get the flu shot, this is going to help protect us from COVID as well?
No, so
or
I think, Oh, go ahead, please.
Oh, no, I was just saying, or is it completely unrelated?
No, it's unrelated. It's a different virus. Mechanism is totally different. So no, flu vaccine will not be helpful for the COVID. There's an indirect help, if you don't get. So what we're concerned about is, what if people get both? People come with the flu as well as COVID. We don't know what the effects will be. I mean, that could be potentially a very disastrous outcome for the community. So, so for a case like that, yes, indirectly would help, but not directly. It's not going to prevent.
So basically, if you don't get sick with COVID, you're not going to be weak enough to also, if you don't get sick with flu, you're not going to be weak enough to also be at higher risk to get COVID. So it's better to be healthy, that way you don't get COVID.
That's right.
Or lower your risk of getting.
That's right. That's right.
We cannot really say that you're not going to get it.
That's right.
Now, going back into the trials and stuff, because I'm getting questions about that. Why have previous vaccines taken years to go into the market, and this one is just going to get out in a couple of months? So I feel that that's why, people might not feel safe with this new vaccine, because, others take years, while this one is going to take, half a year instead.
So that's a good question. Again, this is a crisis situation. It's a pandemic. It's so they are making certain exceptions that they typically don't. So this is something that's globally affected, such a huge segment of the population. I don't know what the latest numbers are. I think it's over 8 million, I think, people that have been affected, and the numbers are increasing by the day. So yes, there's certain things that they're doing on an emergent basis, whereas others, the crisis was not as severe, if you will. So that's why they did take their time in other, for other disease states.
And are there any groups that are at higher risk to get the flu? Like we know that, for example, for COVID, if you're a senior or if you're immunocompromised, you have a higher risk of getting COVID. What would be those groups for flu? Sue?
Yeah, they're the same, the elderly and the very young for influenza, and patients that are, individuals that are immunocompromised for flu.
Yeah.
Right.
So seniors and immunocompromised. What about newborns?
For flu, yes, newborns and young children are also at risk for serious illness of influenza. So anyone under 6 months of age can't get the influenza vaccine, but everyone around them should, to prevent them from getting seriously ill.
Mm-hmm. Is mother's milk gonna help with that?
For the flu, you mean?
Yeah, infection prevention, if they're breastfed.
I'm not sure about the flu, but yes, mother's milk does help. But I'm not sure about the flu. I haven't done pediatric infectious disease, so that's why I'm a little rusty on that. So I don't know what the answer is for the flu. Sorry.
Okay.
Try to find out later.
But the mother should get her vaccine before she has a child.
Yes, for sure.
That's a very good point. So the mother needs to be vaccinated, and maybe that's a way to pass some protection to the baby, right?
Right.
Okay. Now, Enea Suarez is sharing a link here. It's from the FDA, fda.gov, and it's a link that has the latest updates to the influenza vaccine and how they are made. So thank you so much for sharing that. We're definitely gonna be looking at that, and thanks for sharing with the community. I'm actually gonna copy it and paste it. Oh, I can't do that. Okay, but it's fda.gov/consumers/consumer updates, and critical role ensuring supply of the influenza vaccine. Any idea when the COVID vaccine is going to be available? I know that's like a guessing game, but that's a question we're getting here.
Right. So I think the prediction is they're hoping by the end of this year or early next year. That's what they're hoping. But again, as you said, it's more of a guessing game. It depends if they can accomplish this current phase in an effective manner. So it would all depend on that.
Yes. So we are 5 minutes till the end of our Zoom chat here. So if there are any last minute questions that our attendees would like to send us, please do so. Otherwise, Dr. Chak, Sue, do you have any latest thoughts that you would like to share with more than 60 people that have joined us today, to let them rest assured that the flu vaccine is good for them, how to protect themselves? Any last thoughts that you have?
I'm just thankful for the opportunity. I, again, am always wanting to prevent illness. And if you saw from your corner of your eye, I did touch my face once, a couple of times during this. And we just have to be cognizant of our habits and to continue in our diligence on keeping each other healthy And prevention is the key to doing that with mask use and good hand hygiene and influenza vaccine, so that the worry of on all of us, the burden of possibly getting our loved ones sick should be enough for us to do our best in staying well. So I thank you so much for this time.
Yes, I share Sue's sentiment as well. Thank you very much. This was very valuable. As Sue said, we have individual responsibility, then we have a responsibility to our family, to our neighbors, to our community, to our towns, to our cities, states, and country, and the world. So each one of us has to play our role to for the prevention. We're still in the pandemic. It's not over. You know, it's coming back. So if we're vigilant, if we're doing all these things that we just emphasized on, hand washing, social distancing, mask wearing, if we are doing all these things, we're protecting ourselves, we're protecting our loved ones, we're protecting our community, and inshallah, and we should overcome this as you know, as a nation together. It's a war for all of us. It's a battle that we have to kind of go through together collectively, and we will overcome this. Thank you.
Well, I have to say, I really encourage everybody here to take the flu vaccine. I take it every year. I confess I haven't taken it this year. Just waiting for the right moment, which is gonna be right after this. I'm gonna run down the stairs to the second floor and get my vaccine today. And I have to share that I truly believe in the vaccine. Few years ago, I almost lost my husband to flu. And it's because he never wanted to take the vaccine. And you know, I always did, and thank God, even though I was with him, I didn't get the flu. I was okay all the time, but I've seen the consequences of not taking the flu vaccine firsthand. It looks horrible. So same as COVID, same as flu, prevention is best. I agree with Sue 100%. You know, so don't rely on chicken soup or vitamin C or vitamin D. Please do what we need to do. And again, thank you so much from everyone here, or, you know, couple of people here from the attendees. They're saying thank you. Thank you for your time. Thank you for your expertise. Thank you for illuminating us with all these questions. I know a lot of us, you know, have a lot of questions around COVID and flu, and you have been very instrumental in answering those questions. So just to share that we have a whole calendar of events planned. Are you seeing my screen right now? Okay, so we have a few events coming up next week. We're gonna talk about how to have a healthy Halloween. We're gonna be talking about recipes and sweets, and it's gonna be a very cute topic. We're gonna be talking about obesity prevention. October 22nd, we're gonna have Dr. Roy and Katie come back to talk to us about palliative care. Then we're gonna have a whole talk on joint surgery. November 5th, holiday blues during COVID-19, and November 18th, we're gonna be celebrating Diabetes Month with a Diabetes Q&A. So you're all invited. Please help us spread the voice. We wanna grow our community Zoom series as much as we can. And let me just double check here, Q&As. They're just saying thank you. I wanna make sure that I answer everybody's questions. Thank you so much to our experts and our attendees. We will get together soon again.
Thank you.
Bye-bye.
Thank you very much again.